Every year in Australia, around 8,000 women have breast augmentation surgery. It tops the list of the most popular plastic surgery procedures in the world. And now there's a new implant on the market proving to be less risky, longer lasting, and in some cases cheaper. Josh Fazulin has this report.
If you want to enhance your looks, I just think it's a great move. It's a safer move. I just wish that they were available earlier.
They realise the benefits, they want to reduce the risks, they want to maximise the time before they might need a second operation.
They're the next big thing in breast implants, safer and cheaper. Made not in China, not in Australia, but the land of micro bikinis and everything else big, Brazil.
Look at their bodies, they're in hot climate and they're showy.
Mum of one, Emmy Lee, signed up for Brazilian implants a year ago. Breastfeeding saw her bust drop to a AA. Now she's a double D.
I've been stuffing my bra since I was about in grade 5, so for me boobs was always a part of what I wanted to be, and growing up I had a very athletic body, and you always want what you don't have.
But when it comes to plastic surgery, what you want isn't always what you get.
An hour and a half into the flight, I started having this pain in my left breast.
Tracy Collette's implants ruptured on the way home from Thailand, a cosmetic holiday on the cheap she now regrets.
If the bag had burst completely, because it had just ruptured a bit, it could be fatal.
It did happen to me, not once, but twice.
It's taken Amanda Costello 3 times to get it right. Her first 2 breast augmentations with ordinary implants bottomed out.
Within a month to 2 months, I started to notice that they had dropped significantly.
Now she too is barracking for the Brazilian.
I feel how I should have felt the first time.
Another possible complication is capsular contracture, where the implant hardens or changes shape after time. Both problems can be dramatically reduced, according to Dr. Daniel Fleming, by opting for the Brazilian.
It's now been shown conclusively that the risk of getting capsular contracture or hardening with breast implants which aren't Brazilian implants is 1 in 6 by 8 years. With the Brazilian implant, it's 1 in 100 at 15 years.
Standard silicone implants come in a clear or textured coating. The Brazilian has a layer of polyurethane foam, the stuff you'd find in your bed mattress, for durability and comfort. In implants, it works like an adhesive.
What that does is it attaches itself to the tissues around the implants, stabilising it, stopping it compressing like shrink wrap with the ordinary implants to cause capsular contracture, and additionally, it stops implants from rotating or dropping down.
So basically it attaches itself better.
Like Velcro.
Dr. Henrik Sintra is a world expert in cosmetic surgery. He says the other benefit is the extended time you have until the implants need replacing.
I have many patients that have it for more than 15 years, maybe even 20.
He's been working with these implants for 25 years. That's how long they've been around for overseas. Only now has the company in Rio de Janeiro realised the demand down under.
Once they realise the benefits of the pure Brazilian implants, for them, really it's a no-brainer. They all choose them.
While it's a trickier surgery, Dr. Fleming is calling for more surgeons to inform their patients of the option, which is now TGA approved, and in some cases, cheaper than your standard implant.
If your surgeon doesn't offer you these implants, go and find one who does.
I'd just say go for it, you know. It's not a rehearsal.